We welcome you to our channel. We hope this information allows you to take better decisions. Thank you for your time. Ashwagandha is an adaptogenic herb that has been used in Ayurvedic medicine for centuries. It is known for its ability to reduce stress, boost the immune system, and improve cognitive function. However, there are some groups of people who should not take ashwagandha, as it can have potential side effects or interact with certain medications. It's essential to consult with a healthcare professional before starting ashwagandha supplementation, especially if you fall into any of the following categories. Pregnancy and breastfeeding. Pregnant or breastfeeding individuals should avoid using ashwagandha, as its safety during these periods has not been fully established. There is a potential risk of harm to the developing fetus or nursing baby. Autoimmune diseases. Ashwagandha may have immunomodulatory effects, which means it could interact with the immune system. If you have an autoimmune disorder, such as rheumatoid arthritis, lupus, or multiple sclerosis, it's best to avoid ashwagandha or use it under the supervision of a healthcare professional. Thyroid disorders. Ashwagandha has been linked to potential thyroid hormone modulation. If you have thyroid disorders, such as hyperthyroidism or hypothyroidism, consult with your doctor before using ashwagandha, as it may interfere with thyroid hormone levels. Surgery. Due to its potential effects on the central nervous system and the immune system, it is recommended to stop using ashwagandha at least 2 weeks before scheduled surgery. It may interact with anesthesia and other medications used during the surgical procedure. Medication interactions. Ashwagandha may interact with certain medications, including immunosuppressants, sedatives, thyroid medications, and medications for diabetes. If you are taking any prescription medications, consult with your healthcare provider before using ashwagandha to avoid potential interactions. Allergies. If you have known allergies to plants in the Solanaceae family, such as tomatoes, peppers, or eggplants, you may have a higher risk of experiencing an allergic reaction to ashwagandha. Children. The safety and appropriate dosage of ashwagandha for children have not been well established. It is generally not recommended for use in children without the guidance of a healthcare professional. Low blood pressure. Ashwagandha has been reported to lower blood pressure in some individuals. If you have low blood pressure or are taking medications to control blood pressure, consult with your doctor before using ashwagandha to avoid potential complications. As with any herbal supplement, it's crucial to buy high-quality products from reputable brands to ensure purity and efficacy. Always follow the recommended dosage instructions provided by the manufacturer or your healthcare provider. If you experience any adverse reactions or side effects while taking ashwagandha, discontinue use and seek medical attention promptly. Thanks for watching.